The cervical vertebrae C5, C6, and C7 and thoracic vertebrae T1 give off a total of 5 nerve roots that begin the brachial plexus. The nerve roots exit above C5, 6, and 7, while roots C8 and T1 exit below C7 and T1. Each of the 5 roots merge to create a total of 3 trunks. These trunks are labeled as superior, middle, and inferior. Each trunk gives off 2 divisions for a total of 6 divisions, 3 ventral and 3 dorsal. The divisions merge into 3 separate cords, the lateral, posterior, and medial cords. These are each labeled based on their position relative to the subclavian artery. Each cord then splits into 2 pathways, creating a total of 5 branches. The lateral cord divides into the musculocutaneous branch, which is innervated by C5, 6, and 7, and the lateral branch of the median nerve. The posterior cord splits into the radial nerve, innervated by C5 through T1, and the axillary nerve, innervated by C5 and C6. The medial cord splits into the ulnar nerve, innervated by C8 and T1, and the medial branch of the median nerve. The median nerve is now fully innervated by C5 through T1. Several other nerves originate throughout the brachial plexus. Immediately after nerve root C5 exits its foramen, the dorsal scapular nerve arises with innervation from C5. From the roots of C5, C6, and C7 comes the long thoracic nerve. The superior trunk gives off suprascapular nerve and subclavian nerve, both innervated by C5 and C6. The lateral cord gives off lateral pectoral nerve, innervated by C5, C6, and C7. The medial cord gives off the medial pectoral nerve, the medial brachial cutaneous nerve, and the medial antebrachial cutaneous nerves, each of these innervated by C8 and T1. The posterior cord gives off upper subscapular nerve and lower subscapular nerve, both innervated by C5 and C6. And finally, the posterior cord also gives off the thoracodorsal nerve, innervated by C6 through C8.